I welcome very much the statement from the Minister today, and indeed the work that the government is doing, and particularly the HSE, in provision of vaccines and in the reaching out to people to ensure that the most vulnerable in our society are being dealt with fairly and objectively. And I welcome the comments from other speakers here today, and I get a sense here today of us all together working for the best of everybody. There is one issue I'd like to bring up. It's in relation to people aged over 60, the cohort aged between 60 and 69. It's clear now from the Minister knows as well also from Dr. Hoolan's letter that there's a very significant proportion of those. It was on Monday of this week, I think about 75% had only one dose only. So there's a lot of work to be done there. And the difficulty is that there is clear evidence now that getting 2 AstraZeneca doses, while it is very effective, is not as effective as 2 doses of Pfizer. Or indeed, there's now evidence available from the COMVOX study, which is led by the University of Oxford, that 1 dose of AstraZeneca followed by a Pfizer gives the best immunity to people in this age cohort. And there's also clear evidence, that people are concerned about that. So I would ask, Minister, that if you could, to substitute, and if you have the medical advice to do so, and there are some commentators on the media who are very clear on this, that there would in fact be a substitution of the 2nd AstraZeneca for the Pfizer in that age group which is most at risk. The other question that arises in the United Kingdom, I know today that the National Health Service are looking at a booster vaccine for a vulnerable population in the autumn. And could I ask, and I appreciate it's not a question and answer here, that you could correspond with me on that issue. Does the government intend to provide booster vaccines, particularly for vulnerable age groups and vulnerable people in the autumn of this year? And I think that obviously we're learning as we go along, and obviously the best evidence is what we've always acted on. And I absolutely support all of the actions which the government has taken heretofore in relation to this matter. There's a point I want to bring up and to talk about the programme last night on television, the primetime programme. And having worked with you, Minister, in relation to the appalling number of deaths in Dáil Éireann nursing home and the need for a public inquiry into those deaths, having been made aware, as you are, of the appalling situation that arose in Kilbrew nursing home in the past, with particularly deaths there. Last night we have 3 more nursing homes added to that list. We have Ballyknoe, we have Cahercalla, and we have Tara Winthrop. There is a huge amount of concern among all of those families who suffered grievously as a result of the care they did not get. It's described in the Irish Examiner today of one patient talking, and he died later, that he was not in a nursing home, but he was on death row. So many were the dead bodies, he said, being wheeled past the door of his room. There is clear evidence that in one of these homes there was no nurse on duty for a 12-hour period in one of the locations in that home. That is entirely unacceptable. There is clearly mounting and I believe conclusive evidence of a need for an inquiry. And finally, I just want to talk about the Tara Winthrop nursing home. I wrote to the HSE last year listing the 20 nursing homes in Ireland where most people had died from COVID. One of those nursing homes was Tara Winthrop, and I appealed some information in relation to minutes of meetings between public health and the area crisis management teams and records of meetings, with nursing home proprietors. The evidence I was looking regarding Tara Winthrop Private Clinic in Swords, I was refused that information on the grounds that they denied my request on the grounds that it would prejudice the effectiveness of investigations, inquiries, audits into that home. So I'd ask, Minister, that you would now publish, and this is last March, that this information was given. Would you publish the information in relation to those investigations, inquiries into audits into Tara Winthrop, because there is clear and abiding and serious concern about it. I don't doubt, Minister, your integrity or indeed your department in relation to all of these issues. I don't doubt, that there are fantastic, well-run, brilliant nursing homes in this country. But there are a core number which continue to raise serious concern. And I have evidence now that in relation to Dalgan Nursing Home in Dundalk, I have 2 witnesses who have told me they are prepared to give evidence of a very serious nature to the appropriate and proper inquiry. Now, Minister, the families have been in touch with me again today and are publishing a letter to you shortly. But I think you need absolutely to grab this in both hands and to have those inquiries and particularly meet the needs of these families, and particularly all of them who spoke last night and all of the ones I've listed. But Dalgan Nursing Home cries out. It's the only nursing home in which the state intervened and took over the management of Gormargaret.